That government plan to reduce waiting times. Our chief correspondent Tessa Chapman, as you can see, joins us from Wickham Hospital in Buckinghamshire. Tessa, really lovely to speak to you tonight. So let's talk about that plan, because it's right, isn't it, that they're trying to make sure the vast majority of us don't have to wait longer than 18 weeks for that initial treatment.
Yeah, that's right, Dan. 18 weeks is that key figure. It's always been the ambition, but currently only 59% of patients have their first treatment within that time. And as we well know, many are waiting for much, much longer than that, sometimes even years. So the ambition of this plan is to increase that figure to 65% by next year and to 92% by 2029. But given the post-COVID backlog means that in England, the waiting list currently stands at 7.5 million, there is a huge job ahead. Sir Keir Starmer says the NHS is chronically ill. And on a visit to a hospital in Surrey this morning, he set out his treatment plan.
To catapult the service into the future, we need an NHS that is reformed from top to bottom. Millions of extra appointments, signed, sealed and delivered with the plan that we are launching here today.
He's promising to take pressure off hospitals with an extra 450,000 appointments for tests and checks at community diagnostic centres, running 7 days a week. There will also be 17 new or expanded surgical hubs by June for less complex procedures. And the NHS app will be improved to give people more control of their treatment. All of this should give hospitals more capacity for surgery. And action can't come too soon for Jamie Barber. His gallbladder needs removing, and doctors say he's at risk of sepsis and liver dysfunction. His mum's supporting him at home while he waits for NHS treatment.
The NHS waiting list has been like a theme park queue. Like, it's taken ages to get there. I've been on a waiting list for about over a year and a half just to get this little mini surgery done.
Elective surgery hubs like this one at Wickham Hospital are part of the plan too. They're seeing more patients more quickly.
We've managed to organise ourselves to keep our elective work in a separate centre to where our emergency work happens, which means that in winter, despite the fact we've got a lot of pressures and a lot of sick patients coming into A&E, we're able to continue Monday to Saturday most of the time with patients having their planned surgery.
A laser focus on making surgery run efficiently is working. Waiting lists here are down 15%. But there's only so much they can do with buildings in need of repair. They're hoping for new funding.
I think we're constantly looking at ways to innovate and do things differently, but having to work around our estate is a challenge. So anything we can do to provide the right facilities, so for our brilliant clinicians to provide best care for our patients, has to be a good thing.
There are questions too over the workforce required to staff Starmer's big ambitions. Millions are waiting to see if they'll make a difference.
It is a pretty bold plan, Tessa, but it's such a huge task, isn't it? How realistic do you think it is?
Well, I've spent the day here at Wickham Hospital, and I have to say the staff here are feeling really confident that things are moving in the right direction. As I mentioned in my report, they are making sure everything is working really efficiently on surgery days, from the porters to the nurses to the surgery teams. Everything is running like clockwork now, and they say those small differences are making big differences to outcomes. And as well, they're saying the fact that they're ring-fenced, so beds for elective surgery cannot be taken up by people who are coming in with flu, for instance, is also making a huge difference. There's a big focus too on the patients themselves. They're trying to reframe waiting lists as preparation lists to make sure that people know they need to lose weight, they need to stop smoking, they need to be in the best possible condition they can be for the surgery, and then to get better afterwards. So I think Sir Keir Starmer does have a huge job ahead. There is confidence here, but also the fact that he has set those targets mean there will be lots of people holding him to account.
OK, Tessa, thank you. That's Tessa Chapman live from High Wycombe for us on the programme tonight. We've got loads more.